All right. Well, thank you for that nice welcome. Can you still see it just fine?
Yep, we can see it just fine.
Okay, good. Now I can change things. Okay, so just some basic objectives. We're going to talk about creatine and creatinine, to talk about how the kidneys and suggest appropriate lab markers for people to use. Talk about the hair loss myth, and some clinical populations that may benefit the most from creatine. It's not just a bro thing anymore, not just for gym bros, but it's okay if you want to be a gym bro or gym lady. So well, the first things we're going to have walking in our exam room are some people talking about the things they read on the internet, because I have people all the time tell me about how they did their research. And as I'm talking to them, their research is TikTok, and they're serious. So that's what the state of the world and research is now, is researching through TikTok. So we got to do our best to be able to explain properly things. And so a few of the main concerns, kidneys destroy, creatine destroys your kidneys. My trainer or my fellow researchers say creatine makes his hair fall out, and others, especially the mom, when your kid starts taking it, isn't creatine a steroid? So we'll go into that. First, we need to talk about safety, which has been kind of mentioned, but creatine monohydrate has over 680 peer-reviewed clinical trials, nearly 13,000 people in the creatine groups, over 13,000 placebo groups, with no, no indication of harm with use. Doses have been, 3 to 5 grams a day, up to 20 or even greater, like in the one that Isabel showed with the 0.35 grams per kilogram, which can be quite the massive dose, depending on your body weight. And then CreaPure creatine was submitted to the FDA, and it's recognized as generally recognized as safe. And there's I think a similar thing in the UK, and they've also achieved that as well. So the safety in general is established for the healthy person. We'll talk a little bit more about that in a minute. First thing on here, just to go back to the kidney myth. All right, so in general, I know you can read the slide, so I'm just going to tell you what kind of happens. Creatine in our body, or phosphocreatine or creatine, is in our muscle, and it breaks down into creatinine. For years, creatinine has been used to develop through a formula our glomerular filtration rate, or how our kidneys are doing. In general, if the creatinine rises, that's a sign that the kidneys aren't functioning well, but the creatinine is still not the best marker of that. But it's what we use on a regular basis. What most times when you get a metabolic panel, have creatinine on there. Creatinine itself, again, is not toxic to the kidney. It is mostly freely filtered through the kidney. It's not reuptake by the kidney, so that's why it's used as a reliable marker. But other things can make the creatinine go up. For example, if you just don't go to the bathroom on a long car ride, it will go up. If you have a kidney stone before, or I guess after the kidney, you can have the creatinine go up. If you have one kidney, their creatinine goes up. If you have poor blood flow to the kidney, their creatinine goes up. If you take creatine, the creatinine goes up. So creatine will break down about 2% of what you take into creatinine. And so that'll make the creatinine go up, which will make the eGFR go down on your paper, and then everybody loses their mind. So when you think about, with a kidney, abnormal lab for kidneys, you might have somebody's creatinine go up, and one of the questions you can ask, especially these days, is, are you taking creatine? Because not everybody taking creatine looks like again, like the typical gym bro, the guy who has a metrics t-shirt on back from the 80s or something like that, and is muscle bound and everything. And so you don't always look like that anymore. my mom is 75, she takes creatine. So anytime you see the creatinine go up, you can say, well, hey, are you taking creatine? And if it does, you can expect it to go up slightly. Now there's it's a little bit more detail than this presentation needs to be, but there's certain amounts you'd expect things to go up naturally with in the kidney, and things that just too much to go up. But now moving on, say, well, okay, if we want to prevent this person from a referral to a nephrologist and lots of testing, which may even include up to a kidney biopsy, and they do say they take creatine, okay, what can we do about it? Well, one thing is to get a better GFR, you can use cystatin C. Cystatin C is created in every cell in the body, And just like creatinine, it's freely filtered through the kidney, and it can still have the same kind of hangups of building up for different reasons, but it gives you a much better, more accurate evaluation of the kidneys. The KDOQI guidelines, when they evaluate it, they use creatine and cystatin C in their calculations to get a much better estimate of the kidney function. So you can do that to kind of see, okay, how are their kidneys really acting? Another thing is a urine albumin test, and that will tell you more about the kidney function as well. So the healthy creatine user who otherwise creatinine has been normal all along and the number goes up a little bit, let's not put them through a whole lot of expensive testing. Let's just use our brains first and try to cystatin C first and kind of see how that is. Now, the next one on the list is someone who has chronic kidney disease and they may want to take creatine. That's a little different. The research has not been not very thorough on this so far. There's no reason to think that creatine would be harmful in someone like this, but they do need to be monitored. Everything is different when somebody has kidney disease, especially a higher level like stage 4, stage 5. They are different than you and I when it comes down to labs. Everything is different. Every dosing is different. However, there's a great review paper some years back where they're looking at creatine being an absolute necessity for those with chronic kidney disease, because people in chronic kidney disease do not make as much of the enzymes that help our body make creatine. And so they naturally have lower levels of creatine. So that might be a special population who can benefit from it. There are also companies using creatine in their dialysis products for those on dialysis. So at the moment, we have to say, more research is needed. If you came and saw me for this and you had kidney disease, I think that we just kind of talk about everything that's going on in your life and talk about starting a low dose and then probably just checking your labs more frequently. But not everybody's going to kind of do that with you. So you have to, have to be working with a provider who's willing to help you out with it, put it that way. Now, if it rapidly changes the kidney lab, like the fourth line, you definitely can rule out the creatine intake first, but they still need a workup. We can't just blame it on creatine. And then the healthy person asking about it, again, it's safe. There's enough studies to suggest the average person who's healthy that wants to take creatine, they should be fine doing that. Hair loss myth. Okay, this is something that just won't die. It doesn't help that some of your friendly creatine researchers are all bald, but hair loss myth is just one of these, again, myths that just won't die. There's a study in 2009 that's referenced on here. They had 20 people in it, college rugby players. They took creatine a high dose for 7 days and then lower dose for a couple more weeks. And then they measured their testosterone and their DHT, and their DHT went up. And they said, well, it's going to cause hair loss because DHT goes up, you must lose hair. They didn't measure hair. In fact, the DHT levels are still within the normal physiologic range. So there's never been another study until recently that actually looked at this, but it just won't go away. Of course, media and things get on and say, creatine causes hair loss, that kind of thing. If A equals B and B equals, C, then it must A equals C type thing. So what they did in 25 that actually answered the question was they actually took 45 people and they used dermatologists. They used the same kind of tests that a dermatologist or someone else would do to actually count the hair follicles on the head. They followed them along. They went to the part of the hair that's most likely to lose hair. And at the end of the study of 12 weeks, they found no difference overall. You can see in the slide. Overall, there's no difference in the ones who are on creatine versus placebo. A caveat that's in the fine print is the men in the trial, none of them had hair loss disorders. None of them were taking medications for hair loss or anything like that. So that is a limitation. If someone is already having problems with hair loss, is it going to make it worse? It's doubtful, but we can't answer that question yet. So, but we do know that just in general, taking creatine does not cause hair loss. And we don't need that one. Okay. A few other ones we can kind of go through here. Creatine is a steroid. Again, you always hear about somebody's mom saying, you know, I won't take creatine, and their mom says, you can't take it as a steroid. It's an amino acid derivative. It's made from 3 amino acids. It's found in steak and fish. Excuse me. It's not structurally similar to steroids. And in all honesty, if, you know, creatine is a great supplement, but it definitely does not have steroid type effects. I would expect much more out of it if it was really a steroid. So it's not a steroid. Next one, creatine causing dehydration, muscle cramps. That has been going on for a long time too. And when they actually did a real study on this, they actually found that people who were taking creatine in these football practices were having less cramps. It does not cause dehydration, doesn't cause muscle cramps. Bloating and fat gain. Bloating, you know, there's a occasional person who'll tell you they take it and it makes them feel bloated. And oftentimes that was with the old 20 grams a day loading dose, you know, 5 grams 4 times a day. So for, you know, if somebody says it makes them bloat, well, just get them to take a lower dose. Hey, let's just start on, well, it's 3 or 5 grams a day, because that's proven to be just as effective after 28 days as if you do a loading phase first. Or if they've done the 5 grams a day and they feel like they bloat, let's try 1 gram a day. You know, do that for a few days, see how you do, and then just go up from there. As with anything else in the world, food, clothing, you know, or supplements, there's gonna be something you can't tolerate. You know, a lot of people can't wear certain jewelry, something like that. It's, you know, that's just how it is. So if they can't tolerate it, they can't tolerate it. Fat gain is definitely not the case. Creatine causes osmotic pressure inside the cell to increase, pulling water into the muscle cell. It does not increase fat. Numerous studies have taken the time to prove that, but it pulls it into the muscle, which is not a benign process. It's not just hydrating the muscle, but there is actually transcription going on due to that stretch. So it's actually one of the functions of it. And all, you know, weight gain initially with creatine is not all just water. And last thing about GI distress, that kind of goes back to the bloating. That is just take a lower dose and give it a try. Take your time with it. You know, when really with creatine, we're looking at the long game here, not looking at a sprint. So I think you can just lower the dose and start slower. So let's talk about a few high yield patient populations. You know, we're getting away from, again, just the young people lifting weights. But let's talk about, you know, where women may be possibly the highest yield population. This is really interesting to me because I have a mom, a mother-in-law, a wife, 2 daughters. I have a son too, but, you know, thinking about women are very important in my life. And in general, of muscle gram per gram, women will have a lower baseline creatine store than men. And in studies where they look at groups like vegetarians and vegans who have a lower baseline, they tend to be some of the greater responders to supplementation. If it's lower and they have the ability to increase it, then they usually get more compared to the ones that don't. Just a quick caveat on that: in studies that do not measure creatine biopsies and muscle biopsies and creatine early on, they can't really differentiate sometimes. So that's why the studies have done that are really instrumental in helping us understand. But just again, general women's health, there are benefits across the lifespan. One of my references from Dr. Ivy Smith-Ryan, it was really excellent for that. But it goes basically from really from childhood, adolescence, premenopausal, postmenopausal. You know, the effects with lean mass are proven, and, you know, we're not everybody has to be a bodybuilder, but we can all use some more lean mass. The cognitive function, we'll see. Isabel really helped explain that for us. Some studies showing some mood improvements, but overall, it's still, like I said, under-researched relative to the potential. In postmenopausal women, I think what's important to bring up about this is, as usual, we know it's going to improve lean mass, but the bone geometry. You know, some people looked at the study and said, well, it didn't improve the DEXA, you know, nothing on the bone mineral density change. Well, I wouldn't expect it to be honest. Just real briefly about bone density, you expect to lose about 1% of bone density per year. Bone density scanners like DEXA scanners have a 3 to 6% plus or minus error on average. So even in pharmaceutical studies, they're using very powerful medications. They usually look for a greater than 3% change in bone mineral density to call it significant. Again, creatine being a supplement, not a pharmaceutical, not a steroid, you would not expect such great changes. But what was nice to see is that some of the bone geometry changes had occurred that suggest more bone or better bone health. So that still needs more studies there. And then, you see creatine in women with knee arthritis, and what you find is just in general improved physical function when combined with resistance training. So anytime that people can exercise healthy, a joint that hurts, especially leg muscles around the knee, typically good things happen. Again, just to re-emphasize, as far as it goes to muscle and strength, resistance training is key. Creatine by itself in general is not going to be, as far as muscle goes, effective for most populations. So we always need to make sure people get a proper prescription of resistance training. Sarcopenia, there are some increased studies with this, and was proven over and over again, just like in younger folks. Resistance training plus creatine is better than resistance training by itself in both the strength and muscle masses, improving some of their functional improvements as well, which is always good to see. GLP-1 medications and creatine, there are no studies on that right now. So we can read somewhere it says emerging, but basically there are no studies to prove it, but it'll be interesting to see. What we do know about weight loss in general is weight loss without resistance training, without properly prescribed resistance training, results in lean body mass loss. Up to around 25% of what people will lose will be muscle. In many cases, the muscle or the fat loss is so dramatic that their function improves regardless. But metabolically speaking, we need to keep our muscle. So it would be a fair recommendation that if you're, have a friend, a patient, or a client who's trying to lose weight from any method and they're doing resistance exercise, that creatine could be beneficial. But again, the studies do not exist yet, as far as I know. Okay, I'm going to skip this one because I've already handled that. We talked a little bit more about these, the who benefits most. You can look at that later when you see the slides. Just real quick about what people should take with this. In general, creatine monohydrate is key. It's 95% or more of all studies. No other form of creatine thus far has been shown to be superior as far as uptake into the muscle. Just because a form of creatine stirs into water better does not matter. I personally wouldn't dry scoop it, but you can dry scoop it, you can mix it. It's getting in your body, it's getting into your muscle. So stick with creatine monohydrate, the least expensive version as well. We know that, they had done studies where they did loading doses, 20 grams a day, but we do also know that 3 to 5 grams a day is quite effective, especially if you're looking at benefits starting a month instead of, immediately. Timing is really nothing sauce. As long as you take it, that's what's important. If you're looking at creatine purely for muscle dry scoop is the best. You can do that. But we're looking for the co-prescription, absolutely. If we're dealing with muscle, then we need creatine with resistance training. And then especially folks involved in any kind of sport where there's anything to do with testing, the NSF or, for sport or informed choice is a good idea for them. And lastly, if there's any GI issues, just back off the dose, start low, and then just bring it up slowly. This is some stuff for if you're actually a physician assistant like myself, these are some copy paste scripts you can use in the room with the patient that we already talked about each of these. But if maybe somebody could benefit from using these. And just, to wrap it up, bottom line, creatine monohydrate is one of the most evidence-based supplements in medicine. The trials exist, the safety exists, and all the myths we talked about have been dismantled over and over again many times. We've got some people who are the least likely to take creatine are the most, perhaps the most beneficial, or people who need it the most. So we need to keep leaning on our women of any age, especially postmenopausal people with sarcopenia risk. They have the most to gain. We don't need to overclaim or overstate any benefits yet. The cognition looks great, and the benefits in GLP-1 use sound good. But anyway, let's not overstate what we don't know for sure. And I always co-prescribe, resistance training, we need to co-prescribe, properly prescribe resistance training. Every movement is important, but we can get some properly prescribed movement and get some better help for our folks. Here's the references, which you'll be able to see. And thank you for your time and attention. I appreciate it.